All right, well today we'd like to demonstrate to you how to use a particular therapy technique which we find very helpful, a particular intervention called bilateral stimulation. And Shelley, who's on our reception staff here, is going to act as a client, and I'll demonstrate how I use this technique with clients. But first of all, some background. Bilateral stimulation is a technique which involves stimulating one side of the brain and then the other. There's many ways we can do this, including tapping one side of our body and then the other. But another way that we can do it is using clicks, by having earphones in and a click in one ear and then the other ear, alternately. Now, what happens with bilateral stimulation is it's very helpful for if people have worries or anxiety reactions about something. It might be feeling very distressed about a memory from the past, or it could be feeling very worried about something coming up for the future. For example, people might be anticipating a major conflict situation coming up with someone else that they need to sort out. Or it might be someone studying for exams and they're very worried about whether they'll pass or fail. And that can lead to a higher arousal level or a higher anxiety level. Now, there's something about bilateral stimulation that reduces our anxiety level, it reduces our arousal level, it dials it down. And it seems to do that by reducing activity in the parts of the brain that mediate arousal when we are experiencing anxiety. So it dials down the anxiety. There's a particular app called Anxiety Release, developed by a clinical psychologist, Mark Grant. And Mark's done much research in this area, and we've used this app for the last 10 years in our practice. We find it one of the most useful strategies for helping dial down your anxiety. So I'm going to demonstrate how to use this with Shelley. And so we'll start off as a particular situation. I would ask the client, who we've talked about a particularly worrisome situation, Shelley, can you have a particular situation in mind that can bring up some level of discomfort or distress?
Yes.
Okay.
Yeah.
So when you think about that situation, and you don't have to tell me what it is, on a 0 to 10 scale, if 10's the worst you've ever felt, the most distressed, and 0 is no distress at all, 5 is moderate distress, roughly how uncomfortable would you feel now when you think of that situation?
Probably a 4.
Okay, about a 4. Mm-hmm. Is there any discomfort in your body that you notice when you think of that?
Yes.
Okay, where do you notice that in your body?
In my stomach. Yeah.
In your stomach. So many people would notice that, a tightness in the stomach, or it could be around the face, or it might affect your breathing, but many people would notice a tightness in part of the body. So this is how I would start using the technique with someone. I have an anxiety release app on my phone, and so what we would do is use these headphones that have already been swabbed with alcohol, is a way of making sure they're clean, and I'll let you take those, Shelley, and I'll explain that. Good. This is the app here. It's called Anxiety Release. Now, if I click on that, you'll see there are several different programs as part of this app, and we're looking at Anxiety Release 3. That has clicks that when I press this, you'll hear a click in one ear and then the other. Do you notice that?
Yes.
Okay. Now, we'll first of all do this for about a minute. What I'll ask you to do is to focus on that situation that brings up some discomfort or distress.
Okay.
And I'll put this on for a minute, and I just want you to notice what you notice. Let whatever happens happen. Then the first time of doing this, I would suggest doing it for about a minute. And you simply follow those instructions of noticing what you notice and let whatever happens happen. I'll finish it a little bit sooner than a minute because we're doing it for this video demonstration. What do you notice, Shelley? Anything at all?
I notice my stomach getting tighter.
Okay, you notice your stomach getting tighter. Okay, just focus on that. Focus on that feeling and let whatever happens happen.
Okay.
And you'll notice in this situation that Shelley might be preferring to close her eyes, and you can do that yourself. You might have your eyes open or closed, it's up to you. But the main thing is to let whatever happens happen. So if it's after another half a minute, okay, what do you notice? Anything at all?
I notice that I'm focusing on my breathing.
Okay, you're focusing on your breathing. Often people will notice some shift in their breathing. It might often get even a little bit slower or something like that, but just noticing whatever you notice. Okay, we'll do that again. And again here, I would do it for a series of half-minute periods, and each time just check, what do you notice? But if you're using this app yourself, the anxiety release app, you can use it however you like. You can just put it on for 5 minutes at a time and see what happens. Generally, it brings people's arousal level down. Okay, what do you notice now?
That my stomach isn't quite so knotted and it's feeling a bit more relaxed.
Okay, we'll just do this just one more time for the demonstration, but you're noticing it's a little less knotted.
Yeah.
That's usually what happens. After a brief number of times, people notice that the original reaction they have is lesser, showing a dialing down of the arousal, the discomfort. Okay, one final one.
Okay.
Again, if you're using this app yourself, you can play it for as long as you like. Some people might find it reduces the distress within a minute or two. Other people might find it takes longer. And there are all sorts of reactions that people can have. A number of people seem to breathe more easily and deeply from about the second lot of clicks onwards. A number of people laugh or chuckle and say, oh, it's something strange. But often people say it's more difficult to focus on the original problem, showing that there's a distraction element to this task. But it's not just distraction. It also seems to dial down the anxiety more effectively than most other methods that we're aware of. Okay, and now, what do you notice now?
I notice that I'm breathing a lot more deeply and that I'm not quite so anxious as probably what I was when I first thought of the issue.
Okay, so breathing more deeply, feeling not quite as anxious. On a 0 to 10 scale, how would you rate your discomfort now?
2.
Okay, so like a 2. Now look, thank you, Shelley. We'll finish that there. And so what we did then, this is a mock kind of demonstration here, but I asked Shelley to think of a situation beforehand that might be a bit uncomfortable, so you used a real situation there. Yeah. Now what Shelley described there is it went from a 4 to a 2, and the tightness in the stomach became lesser. That's usually how this goes. But even if people start with a level of distress of 8 or 9 out of 10, or even a 10 out of 10, it's a remarkable thing how often, within about 5 minutes, the distress level comes down. And that gives people more confidence that you've got something that you can have with you the whole time. You've got it on your phone. If your mind's busy at night and you're finding it hard to settle before bed, you could put it on for maybe half an hour before bedtime to settle your mind. If you're feeling extra panicky or distressed and that feeling is persisting, it's a way of disrupting that feeling and bringing down your anxiety level. So even though this was a demonstration here, what happened was similar to what would happen when I'm seeing a client here, except often they will have a higher level of distress in the first place. So I really recommend that you have some practice with that you download the Anxiety Release app. There are several programs on it, but I think particularly just using the clicks themselves in itself is very useful, and that's the Anxiety Release 3 part of that Anxiety Release app. And you can also look at a website. Mark Grant, the clinical psychologist who developed it, his website is called anxietyreleaseapp.com. I strongly recommend that you check that out.